This ultrasound study is being performed to rule out the cause of menorrhagia in a 38 years old married female. The uterus measures 131 centimeters in length and 5.4 centimeters in anterior-posterior diameter, and in transverse section it measures 5.8 centimeters and is definitely an enlarged and bulky uterus. Measure again 13.0 centimeters, and this length should not exceed 11 centimeters in a parous female. This dimension, the anterior posterior, should not exceed 5 centimeters, whereas that of the patient is 5.8 centimeters. Then this direction should be again less than 5 centimeters. That of the patient is 6.0 centimeters. So the uterus is enlarged and bulky. This is the anterior segment of the uterus. This is the posterior segment of the uterus in longitudinal section. And here you're seeing the uterus in transverse section. In transverse section. This is the longitudinal section of the uterus. This area is the urinary bladder. So this is an enlarged and bulky uterus. First of all, we have seen it is anteverted. Now let's see the cervix. The area in your view is the cervix, which is this box-shaped area. Now this is the cervix, with this being the anterior lip of the cervix, and this is the posterior lip or posterior segment of the cervix, and this is the cervical canal. Anterior posterior diameter of the uterus of the cervix is 2.6 centimeters and it is with a normal range. No focal lesion seen, and the canal is clear. Now moving upwards, let's see the fundal region and the endometrial canal. This white line that you are seeing is the endometrial canal. It is central, it is clear, and this is the fundus of the uterus. Now in this uterus, you can see, presently you are seeing two focal lesions. This is in the posterior, this is the posterior wall of the uterus, and in it you are seeing a well demarcated hypoechoic focal lesion measuring approximately 16 millimeters into 19 millimeters. So this is one. This is the other one. And this is again in the posterior segment of the uterus. Here you are seeing a small hypoechoic area measuring 11.8 into 8.2 millimeters. This is a subserosal fibroid. in the anterior segment of the uterus. In transverse section, we are seeing multiple focal lesions lined up in the posterior wall of the uterus. In this view, more prominent are these two. This is the transverse section of the uterus. This is the anterior wall, this is the posterior wall. This is the endometrial canal, and these are the focal lesions, and this is the focal lesion. This gives a bullseye appearance, or in other words, you can say it is echogenic in the center and are surrounded by a hypoechoic periphery. This is the echogenic center, and this is the hypoechoic periphery. Further here, you see another. This is the other one, another. Bullseye appearance, echogenic in the center, hypoechoic at the periphery, measuring 19 into 12 millimeters. So most of these focal lesions are seen in the posterior wall, and almost all are well demarcated, are echogenic in the center, hypoechoic at the periphery, few are hypoechoic. This is in the upper segment, which is totally hypoechoic, and there are some few subserosal fibroids in the anterior wall that one of them we just saw. Now, in the anterior wall, you will again see a focal lesion. This is a focal lesion in the lower part of the anterior wall of the uterus, which is echogenic in the center and surrounded by a hypoechoic rim, and is very well demarcated. Posterior wall is seen. Now, these are all solid because none of these give posterior wall acoustic enhancement if you concentrate. So you see this one, this is the largest of all, measuring 20 into 20 millimeters, being echogenic in the center with a hypoechoic periphery, very well demarcated, no posterior wall enhancement, and no calcification seen in any of these lesions. Female is tender to the probe in this region. Now let's see a magnified view of at least one focal lesion in the posterior wall that we have seen. This is a magnified view, and you can see two very clearly. One is at the anterior part of the uterus, this one, and this one. Endometrial canal is this. This is the endometrial canal. So this is a case of multiple solid focal lesions in the large and bulky uterus, and interestingly, none of them is seen encroaching upon the central clear endometrial canal except one, this one. Now this fibroid is definitely giving mass effect on the uterus, endometrial canal of the uterus. And as you can see that the endometrial canal is, there are multiple, one more. Now this is the one that is encroaching upon the endometrial canal. This is measuring 23 into 15 millimeters, is echogenic in the center. You see this echogenic in the center, hypoechoic at the periphery, is well demarcated, posterior wall, no posterior wall acoustic enhancement, no calcification, and this is the endometrial canal, this white line. So it's almost, this fibroid is almost in contact with the central endometrial canal, this area. This is the endometrial canal. So this is a study of an enlarged and bulky uterus, uterus with multiple bullseye appearance to hypoechoic focal mass, solid focal mass lesions, along with many subserosal fibroids, hypoechoic.